So I have a rare kind of clotting dysfunction, which means that my blood does not clot as it should. And I wasn't necessarily I didn't know about it most of my life until I was like a teenager when it actually started causing problems. And the doctors have never really formally diagnosed it with a genetic disorder or anything like that. They just call it a platelet aggregation disorder. So going into pregnancy, they knew that I would have to be high risk, that I would deliver in a center that had blood products, and more support just in case something had kind of happened.
Welcome back to another episode of Beyond the Birth Story podcast. If you are joining for the first time today, I'm your host, Alexis C. Girl mom, angel mama to one of the sweetest boys in heaven, birth trauma and uterine rupture survivor, and former NICU mama. Here you will have the opportunity to ask and have your burning questions answered by professionals, feel connected to other women's experiences as we normalize the different aspects of this journey we are on as moms. The real and raw moments of healing are shared here as we navigate loss, embrace strength, and find hope again while learning to live after loss. Please note the topics discussed on this podcast are for educational purposes only. Please see your personalized medical professional if you have any questions or concerns that arise from listening, including diagnosis and treatment. Welcome. I'm looking forward because obviously I know you had a traumatic delivery and, there's pre-existing conditions and things like that, but I don't personally even know the full story. So I'm looking forward to getting to hear it from you and hear of everything that you conquered to bring your little girl into the world. And if you want to just start by giving us a little insight into who you are and whatever feels right.
Well, I am Caitlin. I am a nurse here in Wainwright. I was not, though, prior to that. I lived in Edmonton most of my life. Kind of grew up in a small little town and then was a stollery nurse for 9 years. So lots of experience like working with kids, kids that had been through, I guess, bad birth experiences as well, parents that had been through a lot. And I thought becoming a mom, working with kids in my past would, gear me up for all of the things that were coming, but it is a totally different experience when you become a mom yourself or you become going through like medical things yourself. So I had left peds because I ended up moving to Wainwright for my husband. And it's probably been about 6 years now, 6 or 7 years that I've been living in Wainwright. So it was a big shock to the system to move rurally and get into the world of, okay, you now need to know a little bit about everything and not just kids. So I kind of started my whole life over, left my really, really close, tight-knit family and all my friends that I've grown up with since I was basically in diapers, came here, and we had kind of been in like discussion for a while in the midst of things about having kids sooner than later, just because I have some pre-existing conditions that I knew going into things would make it complicated. And then also we had been engaged and COVID happened. So we were like, well, we might as well just move on with our lives because who knows if we can even have a wedding or not. So we just ended up trying and successfully got pregnant. And I have a rare kind of clotting dysfunction, which means that my blood does not clot as it should. And I wasn't necessarily I didn't know about it most of my life until I was like a teenager when it actually started causing problems. And the doctors have never really formally diagnosed it with a genetic disorder or anything like that. They just call it a platelet aggregation disorder. So going into pregnancy, they knew that I would have to be high risk, that I would deliver in a center that had blood products, and more support just in case something had kind of happened. So I kind of knew going in that we would not be having a baby in Wainwright, that I would go to the city and do it there. But I was followed most of my pregnancy in Wainwright without any issues. And then just kind of more towards the end is when I was referred to the people that would actually take care of me for delivery. So hematology is like my main specialist that has been kind of following me, and they, from the start, were kind of like, here's all the rules. So I knew going in, I would not be allowed to have an epidural. I would not be allowed to have any sort of measures taken for the baby. So they weren't going to be able to use, like a vacuum or external fetal monitoring, like when they put the probe into the scalp, just in case the baby also would have what I had. Uh, so there was just kind of a lot of rules. And then they obviously had a treatment plan for me if I was to hemorrhage or bleed or anything like that. So they were going to go into it with kind of like, you're going to get these meds no matter what, because they might prevent something from happening. But if something happens, we're also going to have to do this. So it's kind of like a loose plan. And during pregnancy, I had kind of a complication right along 8 weeks where I started bleeding. So obviously, for most people, you think the worst when that happens in early pregnancy, because that's just always what has been ingrained into our mind. Maybe what I didn't realize is how common first trimester bleeding actually is, because it actually has happened now in this pregnancy as well. But yeah, anyways, it freaked me out right away. So I went to the hospital, and of course, when I went to the hospital here, it kind of started the midst of, here's the bad treatment. The doctor was mad because I interrupted his anniversary dinner when I came in for the bleeding episode. So, and I was like, here, I think I'm having a miscarriage.
Yes.
And you're more concerned about your dinner. So, and then unfortunately, like in a small town, it's kind of limited as to what they can actually do to diagnose what's going on. So I had to get blood work and then had to wait for a few days to get an ultrasound to see like what was all happening. Anyways, it, thank God, ended up being fine. It just had to be monitored more because I had what is called a subchorionic hematoma, which kind of formed within my placenta, and it was just like a big sack of blood, basically. So either they just dissolve and go away on their own, which means you usually bleed it out, or you don't even realize that it's happening, or they stay the whole time and then they get monitored very closely because it can lead to lots of complications. So mine ended up going away and kind of just ticked along most of pregnancy until like the 30-week mark, where I went to a doctor's appointment and my blood pressure was super high. And I was like, oh, it's fine. I just, I have white coat syndrome, like check it again. And I mean, as a nurse, like I feel like we're almost the worst patient in a way.
Truly.
We're like, I'm fine. Like I feel completely normal. And I did feel normal. So then, of course, whenever your blood pressure's high like that, they dip your urine and check it and see what's going on. And I was like positive for protein, had the full 9 yards to, okay, you're going down the pre-eclampsia route. Like you have to go straight to the hospital and get some more testing done. So I was like, well, I have my maternity photos today, like now. And in typical nurse denial mode, I was like, I'm going to my photos. I'm not going to the hospital. So, Caitlin.
Slap on the wrist.
So I went to my pictures and then zoomed to the hospital, but because I was like, okay, I better actually take this seriously. Like, let's see. But again, like I felt normal and I was convinced that I was fine and nothing was wrong. So I ended up getting put on antihypertensives because turns out I was not fine and my blood pressure was actually high. And that led to kind of like every 1 to 2 days, I had to go back to the hospital for blood work, monitoring, an NST test. And I was still pretty early on pregnant. 30 weeks, like not term yet anyways. So it's a little worrisome. And so the doctors in the city kind of like had already known, like, yeah, like she's going to end up coming here anyways. And they were in the loop of things, but I don't think they were in the loop of how severe things actually were. Because a lot of the time people would just say, Caitlin, like you're just anxious every time they check my blood pressure at the hospital, or you have anxiety, and just lay down and we'll recheck it again in like 15 minutes. But the meds were actually like not working anymore. Like they had upped my dose multiple times and it was to the point where like it wasn't working. So they thought it was working just fine. And when I'd recheck my blood pressure on the third or fourth attempt, it would be like better. So they're like, "You're good. Go home." And the baby had been fine, like, thank God, up until that point.
Yes.
There was nothing kind of going on with baby. They'd check every time, and they did an extra ultrasound. And so then I had kind of had my planned date to move to the city, and they said, when you move to the city, like, you'll have to start at the Royal Alec kind of from scratch because you've never really been there yet, and um, go check in, go to the assessment unit, and they'll set you up with what they want you to do until you deliver. And so I went, like, I had driven to the city, and I just decided, you know what, I'm going to drive straight there. I'm not going to go visit my parents or anything. I'm just going to go get this all sorted. I had my vehicle like packed to the top with what I thought I would need to live there for a few weeks. And then we had kind of planned that the dogs and my husband would follow, like, when I actually was going to deliver the baby. And up until now, like, we really had no plans because we just knew we were going into, okay, like, however way you deliver this baby, you're not getting an epidural. So you better figure out how to manage your pain. And if you have a C-section, you're going to be put under general anesthesia, like, end of story. So that's kind of all we knew we were really going into at that point. We didn't really know anything else. So I showed up to the unit, sat down, they did my blood pressure, and it was 273 over 150.
Holy
And I was
shit.
like, I just checked it this morning. Like, that was not my blood pressure. Like, do it again. Like, I had never seen a number like that in my life. So I'm like, this is delusional. Like, I just ran from the parking lot. It's got to be that. Like, just recheck it. I took my meds. Like, I swear I'm good. And they checked it and checked it and checked it. And by this time, there was like 30 people in the room. So I was like, okay, this is not good. And they were like just passing me pills, pill after pill after pill. I already had an IV started. Then they started giving me antihypertensives in the IV, and they're like, your blood pressure is really bad. Like, how are you feeling? And I'm like, fine. Like, I've had this for a couple weeks now. I've been treated in Wainwright. Like, I've been going every 2 days. Like, I felt completely normal because I didn't have any of the side effects that people had told me about. Like, I didn't have any swelling. I didn't feel off. I never got a headache once. I had a couple days of like spotty, fuzzy vision, but I never really thought anything of it. So yeah, they were like, you better call your husband. You're having a baby today. I was like, okay, stuff just got real fast. So at this time I was 35 weeks pregnant. So I had made it 5 weeks, I guess, on treatment and somewhat okay. But when they reviewed my numbers, they're like, you have not been okay. Like, your liver function is not good. Like, this has been going on for weeks. There's evidence that you've had severe pre-eclampsia for weeks. So when they were reviewing my files, they were just like, this is like not okay. So I'm like complete panic mode at this point because like I wasn't prepared to have a baby that day. And I was, of course, nervous because it was early. So also my husband was working, and I was like, okay, you were 3 hours away. No matter what, like, we gotta figure out a way to get you here. So I like called him and was like, we're having a baby today. And he's like, no, we're not. I'm like, yeah, we are. He's like, did they check your blood pressure again? I'm like, yeah.
Oh, yeah, they did.
He's like, oh, so it is high. Yeah. Like, you gotta come to the city today, get the dogs in the kennel and drive. So that kind of started the whole like midst of things. And at that point I got like a 10 out of 10 headache, like probably just from the stress of everything, the, I don't even know, the blood pressure, like the reality of how high it was. And then I didn't feel good at all. Like, I definitely started to feel like, okay, this is real. Like, I'm sick. And so they isolated me for COVID at that point because they were like, you have a headache, you trigger for COVID. And I'm like, okay, I don't have COVID. Like, I have a high blood pressure. I'm good. So then all these restrictions came into place, which we already knew. Like, there were so many restrictions to begin with COVID. Like, you couldn't have family come to the hospital. You could only have one support person. Like, my husband had never really even been to any of my appointments during my pregnancy because there were so many rules. And so, yeah, we were like, okay, well, he'll get here when he can. And they were like, we're going to try to just like start inducing you and see how things happen. So they started that before he even got there. And at that point, I already had like 4 or 5 IVs and multiple things running. They started every like oral antihypertensive you could think of, and then they had IV antihypertensives running. And then I had to get started on the magnesium, which makes you feel like a complete, I don't even know how to describe it. You feel like you're like floating and you can't even talk or function or like move properly. And then at that point I was basically like stuck in the bed, and they were like, yeah, you won't be moving or anything like that. And they had started to induce me, and I was just kind of like, well, number one, like I've never had a baby before. Number two, this is very early and my body is not ready. Like, who knows what's going to happen? And like, they had just tried with the Cervidil, and obviously like nothing was going on. So quite quickly they had kind of moved to okay, we're going to the OR for a C-section. And of course, obviously the anxiety kind of built with that too, because I knew going into the OR I wouldn't be allowed to be awake because I wouldn't be able to have a spinal or an epidural or anything like that. And my husband also would not be allowed to be in the room because of that. So they basically just left him in our room once he had arrived in Edmonton. And like this has kind of all been like, this was a span of like maybe 6 hours. Like everything happened very fast. So yeah, they just left him there, took me, and they didn't update him for like 2 hours. They just left him there. And then he was like, obviously like, okay, like what's going on here? Like, and for nurses, like we know what's going on. We know kind of like, oh boy, like this is really not good when there's lots of people in your room. And then you're running like multiple machines of equipment, and you're like, okay, like this is real. And for our like external like husbands who have nothing to do with the medical world, they're probably just like, okay, like
yeah. And especially like first time that was your first baby too, right? He hasn't
don't really
seen
know what to expect. And yeah, so, and he, like, my husband is not a fan of hospitals, anything medical, anything like that. So we had kind of already knew that going into birth, that it wasn't really going to be like his biggest fan kind of thing. So anyways, went back for my C-section, had to be intubated. And then they bring you kind of into the recovery room. And it's when you're put to sleep like that, like you're out of it completely. Like you're not like buzzing, ready to go. And so I don't really know how long anything took or how kind of things progressed from there. Once I was kind of like with it enough, like he was brought to the recovery room area and sitting there, and then my daughter had to be resuscitated at birth with a couple interventions, just because, well, number one, it was early and I was sick, so I'm assuming that was also part of it. And then there was kind of some, talks that she had obviously signs of intrauterine growth restriction. She was born at 4 pounds. So there was kind of, which makes sense with when you have pre-eclampsia for as long as I did. And to be honest, I probably had it even longer without even knowing.
Yeah.
The placenta fails and it does not allow them to grow. So she did end up getting to come and be with us though in the recovery room. Like he was holding her and I was just like delusional out of it. Like, is everything okay? Well, is she here? And he's like, I'm holding her. I'm like, what? Just like, okay. Like, what did you pick as a name? And things kind of got a little hairy from there because I hemorrhaged. So they were giving a few different kind of, medications to try to figure it out. And obviously I had my treatment plan already given to me prior to going into the C-section. And then they were trying to do more interventions because it wasn't working. And like with pre-eclampsia, high blood pressure and everything, it's kind of like a perfect storm where everything is like revved right up. So your bleeding factors go completely haywire because you lose all of that ability to clot normally when you have all these other problems going on and your body's just out of whack. So then I got a fever from some of the meds that they gave, and a couple other things happened in the midst of things. And then I moved back they kind of did like a little bit of a ICU style room where they could monitor me more. Like I wasn't stable enough to go to postpartum because they go down quite a bit in staffing ratios there. So then they kept me kind of one-to-one for a while. And I, unfortunately, because of my blood pressure being so high, and this is also maybe something I did not know, or I should have known as a healthcare professional, my mind, I always thought, as soon as you deliver a baby, preeclampsia is gone. Like, it's the cure. So I was like, I'm going to be good. There's nothing wrong with me anymore. What I didn't know is it actually follows you for a long time, and it causes complications for actually the rest of your life. So that was a kind of a whole other spiel on discharge that I did not know. But my blood pressure was still very high, even though we delivered her. So then I ended up with an arterial line in my arm, which meant I had to keep my arm flat like this at all times, and it could not move. And then they hook it up to this big fancy transducer that reads the real time reading of your arm. So stuck in my room, both arms like this, can't even really hold my baby or move or do anything. And of course, it affects like everything. Like number one, you had a C-section under general, so I never got to hold her, never got to, have any like sort of bonding time or experience. My husband had to do like everything at the beginning. And then I was still hemorrhaging really bad. So they ended up having to put me back under because they had tried several interventions that are very traumatizing. So they do a maneuver where they basically massage the placenta and then use their hands or arms and kind of put them up you basically to stop the bleeding. And they had tried that. And I had just had a C-section. Number one, so painful. Number two, I couldn't take any pain medications like how somebody else normally would be able to because I didn't have a spinal or epidural. And I wasn't allowed to take any anti-inflammatory medications. So it's like, okay, here's your Tylenol. We're going to do this aggressive maneuver to you and push on you as hard as we can to make you stop bleeding. So it was very painful. And then they ended up just sedating me because it was so bad. And I ended up with what's called a Bakri balloon, which is basically an emergency device to save somebody from postpartum hemorrhage. So that device stays in for 24 hours. And it tries to basically give you back some sort of tone to your uterus so you stop bleeding. So I had that and had some not so nice nurses in that process. Some were great, some were not very nice. Kind of, I don't know, not very good experience for some of the parts of that. They wouldn't let me eat, so I didn't eat for quite a while. I couldn't drink. Which was making me miserable because I hadn't eaten in like a couple days and I'm watching everybody around me be able to be normal and I can't. And then my daughter in the midst of things ended up becoming jaundice and of course hypoglycemic. And so she needed more treatment. And like, obviously as a mom, like you kind of feel like you fail a bit because you have all these plans of, okay, I'm going to try to breastfeed. I'm going to try to do all this. And none of that was in the cards for me because I could not move or do anything. But 24 hours after that device was in, it was taken out and it worked. So then I just had to deal with all the aftermath and getting everything titrated and figured out. So I ended up going home on 3 different blood pressure medications. I had some infusions before I left the hospital just to get my counts back up because obviously I lost a lot of blood. And then my daughter actually ended up doing better than I did. She was discharged sooner than me. So she had, a little bit of NICU lights and feeding therapy and stuff like that. And she was good. And she just needed lots of follow-up in the city for the first little bit because of her small size. So we did weekly trips to Edmonton for a while to make sure that she was, growing good. And it was a lot, like postpartum, like just getting slammed into, okay, you have a whole new med regime. You need to check your blood pressure multiple times a day. You just had a baby that you need to keep alive. And then you need to feed her every 2 hours because she's small. And you need to come to the city once a week for her. Never mind me.
Yeah.
So yeah, it was a lot to unpack. Oh, and it was COVID. So the whole time I was in the hospital for a week, no one could come and give my husband a break. He was the only one that was allowed in the room. And they even ostracized us for doing things like, okay, here, I have some food. Can I store it in the fridge? Oh, like, you're isolated for COVID. Like, and he's like, well, what am I supposed to do? I'm already having to buy all my own food and I'm stuck here and no one else can come. Like, I have to store it somewhere. And like my COVID isolation restrictions and tests came back negative long before this even happened. And they still treated us like, no, you can't put anything in there or do anything. And of course, everyone's coming in gowned, mask, glove, like I'm going to pass on COVID to them, even though I don't have it. So yeah, it was quite the adventure. And then honestly, postpartum, I still had to go to the emerge a couple times because I would bleed so bad that I needed more infusions of my rescue meds. So it was a big learning experience for sure, because you're trying to adjust to life with a baby, but you're not healthy per se.
Yeah, no kidding. Your body, that's so much trauma, even just for your body to try to recover in postpartum when you're recovering from normal postpartum as well.
Yeah, and I feel like even as a nurse and a provider now, I have so much more respect for people who have C-sections, because you always see people like, okay, they like leave the hospital the next day, they're like walking, like they're doing so great, and you're like, wow, like that's amazing, like it must not be that bad. But after going through it myself, like I was like, this is hell. Like women go through hell. Like it's incredible that you get up and walk and take care of a baby and can even function. Like I didn't walk for 4 days. I was completely bedbound, and then I was stuck in a wheelchair after that, and it was horrible.
Yeah, that first walk after the C-section, or the first time going to the bathroom, and it's just like, oh.
That was hell. And I had to have a catheter in, and I'm like, oh, this nurse is going to put a catheter in me. Like, this is the weirdest thing ever. It's so awkward. Like, I do this to other people.
Right?
And then that stayed in for like 4 days. So then, of course, you don't pee normally after. It takes forever to even try. And you're sitting there like in pain, like, oh my God, just go. You don't want it back.
Yeah, it's so different. And the uterine massage after, like,
that will haunt me in my dreams. So the first ones, like I said, when it was obviously very traumatizing, because I was post anesthetic, and then they were doing it to try to, basically save an emergency. It was so painful. And then I feel like I had like dreams and flashbacks of it, honestly, because it like just lived in my mind for so long. And then every time a nurse came into my room after and I knew she was going to do it, I was like, oh my God. Like I just had to say a little prayer to myself, because I knew how bad it was going to be. And I'm like, please don't. Like, do you have to? But yeah.
They're like, we absolutely do. You've been hemorrhaging for how long?
Yeah. 0 stars.
Do not recommend at all. You're gonna have to, but like, do not recommend. God, that's crazy. I've heard so many stories lately about like COVID experiences, and like obviously from a professional standpoint and whatnot, I understand that they panicked in a time that they didn't know. But now looking back, it makes me so angry.
Well,
like
you need that support as like a mom. Like I wanted more than I'm so close with my parents. I wanted more than anything for them to be able to come and see me, to know I was okay. They were just getting phone conversations from my husband. Like they also got thrown into the crazy of all of this, because they just thought, I was coming to live with them for a couple weeks. And then all of a sudden it was like not the reality. Like I had a car parked with full in the parking lot at the hospital that they needed to go pick up, and they couldn't even come up and see me or say hi. And even like postpartum though, like having a preemie and then COVID, like, yes, we got out of the hospital and everything, but then I almost got a little bit paranoid. Like, should anybody come over? Like, should people be meeting my baby right now? Like, I don't want her to get sick. I don't want to get sick. So it toyed with our minds for sure a lot. And yes, you're right. As a professional, we're like, yeah, we need to like be smart about this. But also now I'm like, it like ruined so much of pregnancy and postpartum for me. No one got to come to
so much.
There's no classes. Like you didn't get any of that kind of stuff that you heard about from back in the day. And then
like to have zero preparation and then go through something as intense and traumatic as you did. And like, obviously nothing could have prepared you for that. However, like basic postpartum courses or things like that, at the very least, could have helped you with that aspect. And so you weren't trying to navigate it fresh.
I would have been more prepared just in general. Like, motherhood is hard anyways, but never mind coming home and like feeling a little chaotic and disorganized in your own life, having nothing ready or set up.
How was it when you were going back into Emerge after for like your medications and stuff? Were they very understanding and receptive to the fact that you
Well,
were
it's
there?
like every time I go in, they're like, "What is this disorder?" I'm like, "Here's my treatment card. Follow exactly what is on this paper. Every time I come here, this is what needs to be done." Like, it was clear cut, but there was always questions, and then they were always calling the doctor for clarification. And it's like, this is like what needs to happen, and it's supposed to happen like within minutes of arriving.
Mm-hmm.
And like, I would always have my daughter with me because my husband worked, and so it's like you have this screaming newborn and you're bleeding and she's crying and you're waiting for hours potentially, and you're like, just need the IV meds quickly, please, like, let's get on
Yeah.
this. So then I
Like,
ended up getting set up at home with my own injectables that I could just do myself, because it was just so crazy to keep going in and out. And it did get better for sure. It's just, those first postpartum periods and everything are not good.
yeah, no kidding. That's always the worst is when you get all that back.
Well,
Putting
and I didn't
on
breastfeed or
top of
anything,
it.
so it was like, welcome back.
Oh.
You're like 6 weeks, just start bleeding from your C-section, and now you're bleeding again.
Oh my God. That was with my first. It was like to the day of 6 weeks. I'm like, are
Yeah,
we? And I was breastfeeding.
yeah,
I'm like,
yeah. It's
where's
different for
the
everybody.
break?
Yeah,
And then with this most recent pregnancy, it was 6 months to the day. I'm like, oh, that was beautiful.
yeah.
Even
No,
that
it's
extra
so
break.
nice not having one. It's like, oh, pregnancy is great for this reason.
Right?
Yeah,
I'm like trying to process everything you
it's
just told me.
it's a lot. It took me years to process. Like, I just lived in a delusion for the first
Mm-hmm.
long time, and then obviously everyone asks like, well, are you ever going to have another one? And going forward postpartum, I was like on all these meds still and getting lots of follow-ups from the city, and they were like, you can, but these things will be what needs to happen if you do. And it kind of always sat in the back of my mind, but honestly, like the first 2 years I was like, there's no way we're ever having another kid again. I'm not going through that ever again. Like, I can't. And then obviously more time goes by and you heal, or you learn
Mm-hmm.
how to deal with it a little bit better, or know that you've got more support on your side. Like, because definitely, like, the second time around, you have way more hands on deck. You decide that, yeah, okay, I'm ready to try again.
Mm-hmm.
And then everyone's like, are you crazy? A little bit.
Yeah, well,
A
we
little bit.
wouldn't be women if we weren't a little crazy.
Yeah, but here we are.
So do they have like the protocol that they used for you the first time? Is that basically what you'll walk into for the second time?
So this time around, I ended up having like 4 additional specialists follow me. Like, as soon as I found out I was pregnant, I had to get in touch with everybody and tell them all right away. And it was like this big rigmarole. Like, it was like all hands on deck. So they are not doing the same thing this time. Because it obviously didn't work last time.
Mm-hmm.
I bled so bad. So there's a plan in place, but they're going to do other things to try to make it not be so bad postpartum this time. And then obviously same rules, no epidural, none of that.
Mm-hmm.
So I'm already going into it knowing that I'm going to be having a C-section, sedated again, which is triggering in itself. If you've ever
Mm-hmm.
had surgery or anything like that, getting put to sleep is very nerve-wracking. And I feel like it's because like you don't know what's going to happen, and then you like are out of it when you wake up. And I have a lot of like thoughts in my brain where I'm like, how do I know if the baby's like, going to be okay, or like
Mm-hmm.
what's going to happen to me, or am I going to wake up right after, or is it going to be a couple days later because something really bad happens? Like, it's a lot of like internal work that you need to do to go through that when you've been through
Yeah.
it before. So I'll go into it with like all of that kind of stuff, an extra plan of maybe, we might have to do these blood products this time, and we're going to try to give these meds this time prior, and then postpartum they're kind of do something every 6 to 8 hours just to see how things go, and then oral meds after for a while to kind of slow things down, and then that's for the bleeding.
Mm-hmm.
If I don't get pre-eclampsia this time, we'll be really clear sailing, hopefully.
Yeah.
But if I get it again, then of course that's going to add on to it. So I am being followed by maternal fetal medicine this time. So for a while there, I was going once a week to the city for like monitoring at the beginning, and now it's kind of step back a little bit, but they're still kind of always in the rear view, and they're really on top of things. So in general, this time I'm being followed way more, monitored way more. So I feel like things won't be, missed. Plus, I'm doing my own blood pressure at home constantly. So that helps, because then you kind of already know where you're sitting. And the minute it gets high, I'll know right away.
Yeah.
And can hopefully, get started on all the things that are necessary. And this time around means a lot earlier moving to the city, to be, closer to the extra help. And like, I've already been pretty much told, like, if anything happens in Wainwright, like, just go straight to the city. Like, do not go to Wainwright. Like, they don't have the blood products for me here. The capabilities and stuff that I would need are just not here. So it wouldn't make any sense to try to, make it a stepping spot.
Just take a one-way ticket to the Alec.
Yeah, basically. Yeah. So and there's been like some learning experiences along the way too. Like, I had originally been referred to one doctor, but I really wanted to stick with my original doctor. I just couldn't get into her in the time that I should have been seen. So then I went to a different one, and I'm like, I'm just not sure. It's not really working for me. I still want to stick with my other one. So I switched doctors in the process, which is a way better plan and decision for me going into everything. But I don't know.
I feel like that's a big thing. It's like, even when people don't feel comfortable, we don't necessarily, like, when we don't feel comfortable with a provider, we don't necessarily feel comfortable enough to switch.
No, but I think like shopping is kind of, you may not feel like it is, but when you have the option and it's there, then it's like, you got to do it. You got to pick what works best for you. And like,
it can make or break the experience too, right?
Like, the OB is
personally
like
speaking.
doctor. Like, she is my provider. And I, like, when there's like so many other specialists and people involved, you want somebody like, at the front of the car, like leading the pack. Not like everybody's just like wishy-washy. Oh yeah, we'll do what they say. Or that note says this. Or you want somebody to be like, no, this is the plan. We'll see what everybody else contributes, but this is what we are going to do.
I liked what you said in the beginning, where she said she referred to herself as the driver of the car.
Yeah.
I think that's
what
so
I wanted.
important.
Like,
yes.
I just felt like, so it's not like I was like led astray or anything, but I did go to one appointment and I just got a really bad vibe from it, because it was like, yeah, I'm just the person that takes the baby out, is what they said to me. And I'm like, not really. Like, you're the person cutting me open, doing the main procedure, and you're in charge and my admitting physician in the hospital. Like, you're actually like everything.
Yeah, especially when it's just specialist. When it's you. Yeah. It's not just taking the baby out.
Yeah. Well, and like, when people come in the room and they're like, so I read your chart. Wow. You're like, yeah, thanks. Like,
you're the phone call that they're obviously happy that you're pregnant, but that they never wanted to get.
Yeah. Well, and to be honest with you, when I did get back into with my original OB, like the one that I wanted to see, I walked into her office and she was like, I did not expect you to ever get pregnant again. But I wasn't offended by her words in any way. It was kind of just like, yeah, I didn't think I was going to either. Like, it took me a long time to get this to this point. And even like my husband, like, he has been asking for a long time. He's like, yeah, like, I think we should have another. Like, are we going to have another? Are we going to have another? And it's like, it's a big thing to take on, like, because I'm the one that's going to be going through all of the the trauma part, the medical part, and it's a lot to say yes to. But when you want more than one kid in your, plan, then you want to try to, I guess, make it happen.
Yeah. Well, it obviously didn't totally traumatize him forever if he's like, let's do it again.
Yeah. No, he was like raring to go. He's like, when are we having another? And I'm like, oh my goodness.
Like, do you forget
too much to unpack? Like, this was a lot for both of us. Like, it definitely, obviously, more so for the one going through it, but it, like, for somebody that doesn't like hospitals, like I had said, like, it was a lot for him to have to do, and he had to do everything himself. Like, it's like, welcome to fatherhood. Your wife can't move. Go and figure out how to feed your baby, change your baby, do everything yourself. And like, she's literally a potato in the bed and isn't doing anything, and you have to figure it all out. Your first time dad, good luck. And when you're on the postpartum floor, like once you're, you know, more stable, and I got moved out of the higher observation area, like no one's in the room, no one's helping you. They have such a huge assignment
Mm-hmm.
that they have to be responsible for. Like you see them like once at the most inopportune times, I will tell you that.
Mm-hmm.
Like they would come in and check my vitals at 11 p.m. and then they'd come do blood work at midnight, and then they'd come check on baby and want to weigh baby at 1 a.m. But then they're telling me you need to sleep.
Yeah. Like
When
when though?
yeah. So I really honestly did push them too. I was like, please just let me go home. Like I need to go home because I need to rest. Like, and we're not getting any rest here at all. And like,
No.
I know that there's always those funny memes on the internet that the husbands complain about those like chair beds. Meanwhile, the wife's the one that's gone through the birth and everything. But like my husband had to sleep on that for like a week.
Mm-hmm.
The poor guy. And it's like, they don't let them shower or do anything, or
No.
it's like, here's your blanket. Like, good luck. Godspeed.
Yeah. I know
So,
Paul literally just had a chair
yeah.
in our postpartum room. I'm like, sorry about it,
Yeah.
but you're not leaving me tonight.
Well, and I was like, you know, like he had said, like, let me know if I can like go like to your parents and shower, or like should I go spend the night there? And I was never ready for him to leave. I was like, you can go for like lunch and stuff, but like please don't leave me by myself at night. Like I can't even like walk or do anything properly yet. Like just stay.
Just
And
having your support person too. And
yeah,
if you can't do anything with your baby, like
no,
your baby
no.
needs them.
I was like, I don't feel good enough yet for you to just leave. And then we still had to venture all the way back to Wainwright eventually. So we had his vehicle, my vehicle, and I wasn't allowed to drive. So my family had to follow me in my vehicle and get it home. Once we finally kind of did decide to come back, we stayed in Edmonton for a couple days just to make sure like that I was okay to go back and not have to drive all the way back to the city. But yeah, we'll see how things go this time. I mean,
well, I hope they go much better.
go into it with a lot of thoughts.
Yeah, no kidding. And like take time to reflect on those, right? And give them space so then when you walk in there to deliver, it's not suffocating.
Yeah. Honestly, I still think that the biggest thing for me will be like getting put to sleep. That'll be like the ugh.
Even I've never been put to sleep, and even the thought of that just gives me the ick.
Yeah.
Let alone when you are going into it with obviously past trauma from your delivery, and two with your condition, and like you said, not knowing.
No, it's so and like I said, I really hope I can just like skirt by this without getting any other complications, because then at least we only have to deal with one thing, and hopefully it's not nearly as bad as the trifecta of events that happened last time. But
this may be a silly question, and it's like a kind of a personal one, but with this condition, if you were to like have your lady bits removed after, would it help with your hemorrhaging, or does
they wanted to know, number one, if I wanted to get my tubes tied this time around. Because like, do you want more kids or not, kind of thing. Because if they already have me open, they might as well do it to prevent me from having another procedure.
Yep.
Number two is, in the case that you hemorrhage as bad as you did last time, can we do an emergency hysterectomy, which would be like a life-saving surgery to stop the bleeding. So that, I think that would have been explored last time if they didn't get it to stop. They would have tried to do that, but it never ended up happening because the balloon procedure worked. So
thank goodness.
It's definitely like on the table that they would do that if it doesn't stop. But in general, I don't think people they don't like to remove uteruses if they don't have to anymore, because it causes a lot of other problems down the line, like as you age and get older, with like pelvic floor and bladder tone and all that kind of stuff. And so we will see, but it is on the table if things are really bad. Yeah. And obviously, like at that point, you want to do whatever to save you. Like I still even remember like postpartum last time, like the doctors were like, you really need to consider if you want to have another one, because do you want to be around for your daughter that you already have? And do you want to be around in general? So that took me a long time to like unpack and be like, okay, but they still gave me all these conditions. They were like, if this, and this, and this happens, you're good to go. And then
like everyone's so much more informed this time around too, right? And
all the right people were involved this time that should have been involved last time. Like with a genetic disorder or like a bleeding condition, you already should be followed by maternal fetal medicine, period.
Yeah.
The minute I had pre-eclampsia, I should have already been followed by them as well last time. But I mean, things happen quickly or not at all or whatever.
Yeah. That pre-eclampsia is no joke.
I can't believe how common it is, though. The more and more, like, now that I've been through it and talked to people, it's so common. So many people get it. And what I did not realize is like the lifelong effects it's going to have on me. Like I was followed for a good 8 months postpartum just because I stayed on the blood pressure meds because my blood pressure did not come back down to normal right away. It did take a long time. And you have to like wean them according to what your numbers are sitting at. And then they informed me that now, because you've had this, you are at a risk of hypertension and diabetes for the rest of your life. And like the risk of diabetes is like 60%. Like it's actually very high. And that's not just gestational diabetes. That's like diabetes, like for your future. And then the hypertension. Yeah, definitely. It's a big thing on the list. So they make you basically be followed by a family doctor every 6 months to check your cardiac function. And if you have diabetes or not, you have to get screening done all the time. Like, even though I'm considered like, well, I'm not like youngin' anymore, but
oh yeah,
young
right.
enough. And like, it's funny because I always like think of like people, you know, with diabetes and heart disease as like these really like unhealthy looking people. Like you put like a frame on it, right? Especially being a healthcare provider, you're like, yeah, okay, like you don't think of yourself as to be one of those victims that, crap, I'm going to have these like comorbidities now. So you definitely want to do the lifestyle changes and things that they put in place, even though like it might not even be a change. You might already do that. You want to keep up with it because you don't want that stuff following you when you're in your 30s.
I feel like it's easy to have those thoughts in our head too, because generally the diabetics that we see in hospital are generally people that haven't taken care of themselves.
100%. You wouldn't think of it as like, you know, somebody that's like young. They had a baby and now they have.
Yeah, I know a couple women now. Yeah, that since I announced that I had the gestational diabetes, they came forward and like, yeah, please get checked. Like we have it now because we had it in pregnancy. It never went away.
Yeah.
And so I did I think I was a couple months postpartum, maybe 3 months postpartum, and I went and redid my sugar drink and everything, and the 2-hour one again. Oof. Not near as sick this time around, but
my first one I don't remember it being that bad, but when I failed it the first time and had to go back a second time, it was like I was going to get sick for sure.
Oh yeah, it made me feel so ill. Well, I am so happy you are being followed by the best of the best.
We'll have to see the closure of this story. Will have to be what happens after this one.
Yes, and I pray with every fiber of my being that it's all good, and you guys deserve that.
Yeah.
Dawson, or your little girl, deserves her little baby here.
Yeah. Sure.
And to walk that road with you guys, and
I'm really hoping we get the whole experience of, okay, she can come to the hospital and meet her little sister kind of thing.
Yeah. So. It'll be so different, that delivery, not during COVID. Like, I never required care during COVID. However, just working in it and like hearing so many stories. Yeah. And like your delivery and stuff, like it feels so inhumane at this point that so many things are taken from people. However, this time I have to believe that you guys are going to have, in quotations, a normal experience, right?
Yes.
Well, I really appreciate you sitting down and talking.
I feel like all I did was blabber out medical.
That's your story though, you know, like don't ever feel bad, and you laid it all out on the floor, or all out on the table for me today. I don't even know what the right term is. One final question though, what would you, even if it was going back to tell yourself, like a piece of advice for a mom who knows that they're going to have to go under general, what are you going to tell yourself before you go into that surgery?
This time I'm going to meet with anesthesia prior, just to have some sort of plan. And that is an option that hospitals like push for. And they even offered for it to be just during one of my routine maternal fetal medicine appointments. So like if you have the option to talk to somebody about it, like it may not be the exact doctor that's going to put you to sleep, but at least if they're on board and they know what's going to make you feel a little bit more comfortable and maybe not as like, panicked or urgent or scary. I think that would help people, because at least like, I know what to expect because I was an OR nurse. Like, I set people
Yes.
up for that. And it is nerve wracking no matter what, when you have people in there, like, they're nervous, they're getting put to sleep, they don't know what you're doing, you're attaching things all over to them. So I
Yeah.
think that talking with anesthesia prior this time and like kind of making some sort of plan, even if it's not the perfect plan of what ends up happening, at least they know like me and like what happened to me last time. And like when you wake me up, like, please just make sure someone's like there, not like leaving me like clueless as to what's going on, because I might wake up like surprised or freaked out, or
Mm-hmm.
never know how someone's going to emerge out of anesthetic. And I've been crazy before emerging from it. Like, I remember when I was a kid, I ripped my IV out. So I'm like,
Oh
maybe
my
someone's just
gosh.
there to like calm me and explain
Yeah.
everything to me. I think it'll go a little bit better this time, because
And immediately connect with you
yeah,
on, like, is your baby okay? Are you
so,
okay?
like, I think
Right?
those are going to be like my most like
Yeah.
panic questions. Like, is everything all right? That's all I want to know. Because like, even last time, like, I had no idea my child had to be resuscitated for days after. And then of course the Connect Care nowadays, like, everybody has access to everything, and all of that reports got sent to me and I had to read it, and I was like, ew, that's lovely. So you just don't know
Oh,
because you're asleep. Like, so yeah, being
that
told
makes
all
me
that stuff I
sick.
think will be better this time.
100%. Just having that line of communication
Also,
open, right?
in that sense, though, I will say that I'm very glad that I was asleep, because I don't know if I would have wanted to watch that, and I don't think I would have wanted my husband to have to go through that at all. So I'm like, it's
Yeah.
almost better that, he seemed like he had been waiting forever in that room and no one was updating him, and I was just asleep doing my thing. It's almost just better.
Yeah, I can speak to that, and I'm sure my husband would say the same, that it's not something you want to hear happening or see or
No.
watch, and especially like, and from both sides, you and I know what happens there, and they don't,
Yeah.
and so it's scary from both sides, right? So, well, I will be thinking of you
Thank
during this
you.
delivery, and I cannot wait
I will
to
keep you
hopefully
posted.
hear a good outcome. Thanks for listening to this week's episode. Please take a moment and, on whatever app you're listening to us on, press that follow button to stay up to date with all future episodes. If you or someone you know are interested in being a guest on the Beyond the Birth Story podcast or a sponsor, please visit our Instagram or Facebook at Beyond the Birth Story podcast and send a message or fill out that contact form. I would love to connect with you. As always, remember to be gentle, kind, and hold space for yourself when you need it.